Our director of marketing.
Me. Yeah, so my role here is the director of marketing. So I ease the initial evaluations in the door. My target for the year is 60% of our initial evaluations are going to be Prime. Our Prime program is our self-pay program. Prime has a nice ring to it rather than self-pay. It sounds like Prime, your VIP, all that stuff. It sounds better. So it is a daunting task coming. As us starting in 2005. Solely 100% insurance. We were in pretty much over basically every insurance that there was on, and not just the normal ones that you know of, but also ones that were from up north. So we would be Blue Cross Blue Shield of Florida. We were in network with Blue Cross Blue Shield of New York and this and that, anywhere around the country. So going from that to what we're targeting this year. But January, we were at 30% in our Fort Myers location, which is awesome. So that's a great start in launching us, towards the end of the year. But what it really does for us is that's the type of patients that we want in the door. So my why, being the head of marketing, is I can control who we're bringing in. I want the people who want to get better. I want the people who care about their lives. They want to, do all the things that our therapist program. I don't want a person that never works out, never eats right, wants to depend on all the meds. The only reason why they're coming to therapy is because their doctor said, I'm not giving you any more meds until you go do therapy for a month. That's not our avatar. We've put in a program now where we've actually, for the first time ever, we're triaging the patients that are coming in the door. So we have people who are Prime, they get access to us within 48 hours, 24 hours most times, 48 hours are in the door. If they want to use their insurance, let's say they are one of our avatars, one of our athletes, Sally twisted her ankle last night, the mom's calling, can you get her in? Yes, we can get her in tomorrow. This is our Prime, we'll get you in VIP. Well, actually I want to use my insurance. Oh, okay. Well, and then we have a spiel in place to say, you have access to all of our elite services. She's going to get better faster. This, and that. We can actually do a diagnostic ultrasound to determine the extent of the injury. Sally's mom's still intent on that insurance. Okay, well, we'll take your insurance information, but unfortunately, because of us having to authorize that, it's going to be about 2 weeks before we get you in. Guess what happens now? The mom's thinking, okay, we'll do that program. So it's just a matter of the mindset and how you get and direct, like what, they don't know. We assume that they know, but they don't know until we educate them. And then once they see, you can do imaging and treatment and everything on the first day, and you'll know exactly what's wrong. Heck yeah, the price of that is like, it's priceless. So that's my why. I want to get those people in the door that, are our true avatars. And the people, like, I said, our staff wants to see, so we have a happier staff in general.
So if we look at 2022 versus 2023, when we started creating this ecosystem of champions at the helm of these various areas, because before this, Joe was doing evals and Joe was kind of doing diagnostics and Joe was doing kind of all the things and marketing and I don't know whatever. And we were kind of a mishmash of, we were just all trying to do everything. Yeah, we were all trying to do everything. So when we look at 2022 versus 2023, our percentage of evals having diagnostics increased from 19% to 32%. Yeah. Interestingly enough, we had almost that same exact growth of the percentage of lives that we were able to change, percentage of visits through our door. Of that percentage, how much of that revenue was in Prime or self-pay? Interestingly enough, that also went up 19 to 33% in a 1 year period.